Dr. Hawary, I would like to talk something which I think is, well, anyway, personally to me, I think it's important, and I think it's just very important for people. And I don't think it's stressed enough. So anyway, let me talk about periodontal disease here. Most dentists, they will tell you if you have periodontal disease and if you don't fix it, you will lose your teeth. Most of them, all of them. And that is very bad, I agree. However, losing your teeth, at least all your dentists, not all your dentists, but dentistry in general, does do very good job in replacing teeth, implants and all kinds of other ways. Even dentures which have a few implant-supported dentures and are very inexpensive but yet very good. So anyway, you're good at replacing teeth. But here's how I see it, and please, Dr. Hawary, tell me how much of the rail I am. While a person is about to lose his tooth, it may take 2, 3, 6, whatever years. During that time, he has an infection in his mouth. Yellow, reddish, ugly pus, which drips into his blood. The mouth is the gateway of all the blood vessels. Not for nothing, when you are unconscious, they come and they drip something under your tongue and you go, ooh, I'm here. Where was I? So, while that is happening, that the blood gets poisoned, the kidney gets damaged, the liver gets damaged, the heart gets damaged, the blood in itself gets damaged. You can have a stroke, heart attacks. They tell us that apparently, and you please correct me or not correct me, ladies get premature babies and thus underweight babies. Now, that's all very drastic. In fact, in California, apparently a lady even had a stillborn baby, and because they found the pus, that infection in her placenta. Now, if that's the truth, wouldn't that part be much, much more devastating than the actual loss of the teeth, which at least can be replaced? We're not living in the George Washington time where we have to put wooden teeth in it. So, tell me, how far off am I here?
There are two very important elements here that we're talking about. The teeth are part of the body. So there is the teeth themselves that we don't want to lose them, because when we have teeth, we speak better, we have more self-confidence, we eat better and digest better and be healthier. So the teeth themselves, as a part of the body, we need to preserve them, because that's a very important part in the digestive system.
No doubt about it.
Yes, and there is another element here, as the impact that happens to the body, heart problems and all of what we talked about related to losing the teeth. So even if dentistry today is very good about replacing teeth, in general, there's nothing better than natural teeth. Nothing that lasts better than natural teeth if they are healthy. And nothing would feel more natural, and nothing is...
I got that. I want you to answer me the questions about, are those illnesses really occurring if they do? All right. At this moment, I don't care about the natural teeth feeling better. We know that, but the fact is, people, put it off. They don't realize it. The point is the poisoning in the body going on the way I'm talking about? Is it really true that babies get born premature? Is it true that diabetes is going to become much more blooming and more heavy if you have gum disease?
Yes. Gum disease here causes a lot of systematic problems. A lot of the bacteria that is in the pockets causes a lot of the heart problems. And that's why in order to have a healthy heart, we have definitely to have a healthier mouth. A person that has diabetes, for example, would be much better off if he is taking care of the good oral hygiene, has no plaque or no calculus in his mouth. That would lead to a lot of infection, a lot of bone loss, a lot of pus that's going to his system, and so forth. So definitely the gum disease is something really bad that causes a lot of systematic problems and psychological problems, as I mentioned, by losing these teeth and being edentulous and having to go through a lot.
Let me interrupt you here, doctor. So you said something important here. You said that, a person who has diabetes better takes care of his gum disease because the gum disease just simply drains and makes the diabetes more severe. So it does it with everything else also, immune system and stuff. In fact, lately, over the last 2 to 4 years, I have found out that more and more surgeons, regardless whether they do a meniscus operation or a hip operation or a appendix or tonsil operations, they insist in the patient getting his oral health, his periodontal disease fixed before they can operate, because the surgeons have realized that if they start cutting anywhere in the body, A, the body is so weakened that any complications could occur, and B, that disease, that bus, that infection is traveling through the body and infects the other wound which the doctor cuts in, and thus that wound might not be healing and again cause much, much more complications. And more surgeons are catching on to that. Have you observed that also?
Yeah, absolutely. And we have to understand that gum disease is happening due to the accumulation of the plaque that becomes calculus, and this is bacteria. It's literally masses of bacteria, and the bacteria can cause all sorts of infections in different parts of the body because we are just having a very septic spot in the mouth, in the body, that can have this bacteria migrate from one area to another and cause that damage for the body.
And if those bad things which we mentioned here can happen, is it possible, does it make sense that a person with a periodontal disease, a little bit like a person who has missing teeth and because of it might have headaches, that his lifestyle becomes diminished, he's going to be more sick, more tired, more exhausted, just not so vibrant as if he would not have that infection, if all the soldiers in the body, don't have to fight that infection? Is it possible that such a person is more susceptible to get the everyday flu and to become more sick at the drop of a needle and be generally more exhausted, more fatigued?
Yeah, again, gum disease has different levels, and as it becomes more mature, there are a lot going on, from losing teeth and not being able to eat to a lot of chronic abscesses in the body that takes a lot of the immune system, that makes the patient has to take antibiotics over and over, to pain and discomfort and fatigue because of not eating well, to complete swelling and missing work, and a lot of things happen when we have things like that in the body, and it's definitely much easier to avoid being in that situation, because dentistry today gives us a lot of tools, very simple stuff, to be having a healthier gum and healthier body as well.
And we're going to talk about that in another video. Thank you very much, Dr. Hawary. Very informative. I think people watching this will be perhaps just taking a little bit more, well, hopefully a lot more care of their gum, because a lot of people have it. An infection in the gum seems to be as big as a hand, and people just don't see it. It doesn't hurt, so they kind of go, oh, my last dentist didn't tell me. And so why all of a sudden I should do it? And they don't realize. If people would have a small little, like a dime, like a little penny of an infection on their hand for more than a week or two, they go to a dermatologist, as they should. But in the gum, in the mouth, they have a huge, hand big infection. And what do? Nothing. And they don't realize they're risking not just risking, they for sure are damaging liver, kidney, heart, blood, stroke sinks, immune system goes down, name it. Thank you very much.
Thank you.